Ladies and gentlemen, welcome to my blog and welcome to Radio Brisbane. I was very fortunate to have a doctor. Doctors are very hard to get to interview, because you are so busy. Well, I mean, the good doctors are always very busy. And today I have Dr. Ahmad Ali with me, and very fortunate because, as you know, my blog is called "It's Never Too Late." I started it at age of 71.
Mhm.
And I thought, look, it's never too late to have fun and do all the things that you want to do rather than sitting on a sofa and wasting your life away, right? So
Absolutely.
that's why I started. And I thought along the way, I would interview doctors and get more information out to mostly the seniors out there and anybody else, you know what I mean, doctor? So, doctor will introduce himself because the credentials, I tell you, he's a urologist and he practices at Sunnybank Specialist Suite, Ipswich Urology Clinic, Redland Specialist Center, and Broadwater Specialist Suite. So
Springfield.
yeah, so he is very busy, and doctor, thanks for giving me time. And I mean, it's a very important issue, medical, especially being a urologist. And I would like first to hear from you about your credentials. How, yeah,
Thank you for giving me the opportunity to come to
welcome.
this, and so I hope it helps the community, both locally and state-wise. My name is Ahmed Ali, Dr. Ali. I'm a urologist. Basically, I left Pakistan at the age of 19.
All right.
I went to New York and I did my biochemistry there, bachelor, from
Okay.
University of New York.
All right.
And
Yeah.
after completion, I had difficulty to get the green card. So I migrated. I got the skill migration to Australia, and then I applied to medical school. I got accepted to University of Sydney,
Yeah.
and I finished my medicine at the University of Sydney. Following that, I did my internship at Royal Prince Alfred. Following that, I went to Canberra for 2 years of basic surgical training. Then I went to WA
Okay.
for general surgical training, and I did some
Okay.
cardiac surgery. And then I
Acha.
applied to urology in 2008, and luckily I picked up the right specialty, so I
Yeah.
can help the
Yes.
men
Yes.
and women plumbing problem.
Yeah.
And currently I'm living in Brisbane,
Yes.
and I work at 4 different hospitals.
All right. Um, prostate health. I mean, this is one of the very common things that come up, doesn't it?
Prostate is a gland. It is equivalent to breast in female, and it produces a bit of juices. Everybody has this question: what is prostate? What does it do?
Yes.
But the
Yes. Yes.
simple word, prostate is a gland. It produces some juices. The juices helps the semen, the sperm, to
Yep.
be healthy.
Okay.
So, but prostate can get two problems. It can get big as you get older. The
Hmm.
prostate gets bigger, but it also can cause prostate cancer. So when it gets bigger, you get the symptoms. But when it has cancer, you don't have any symptoms.
Oh, really?
Yeah. So the best way to see if you have cancer from the age of 50 and onward, you should have a blood test every 12
I
months.
was going to ask you, at what age do you think the cancer sets in? Is it at probably a certain age or is it any time?
The best time to start screening, if you don't have any family history of prostate cancer, you should start checking your PSA from the age of 50, once every year or once every 2 years.
Okay.
But if you have a family history of prostate cancer, then it should be done from the age of 45.
Okay. Just pause 1 minute. I just want to make sure that it's recording. Okay, good. So you said age of 45, you
If you
should
have a
start
family history.
if you have a family history. Okay. I mean, where we came from, there was nothing like that, so nobody checked, you know.
Yeah,
So, what are the if you don't get cancer, but you have the enlarged prostate,
yeah.
what happens then?
So as
Symptoms.
I said to you, that there's no symptoms from cancer unless you have advanced cancer. You don't want that. But the symptoms from an enlarged prostate, people wake up about 2 to 3 times in the night. They have poor flow when they pass urine. The
Oh, right.
stream is slow. Sometimes they have a sensation that they haven't emptied their bladder well. They feel like they want to go back within half an hour, sometimes 10 minutes, and they have this hesitation to start urination. So that's a sign. These are some of the symptoms that your prostate is
Oh.
getting bigger.
So what do you do when you have that?
There are few options. So the first thing is try not to ignore it. If you
Okay.
ignore it,
Yeah.
eventually you are slightly damaging your kidneys and bladder. So the first thing, go and see a local doctor. He will refer you to a urologist. He will do some basic tests, and then when you see the urologist, then he will discuss different options as to what are the best way depending on your symptoms, and there are certain score we have to look at.
Okay. Okay. Moving on from there to kidneys.
Kidneys, I mainly look after kidneys in terms of kidney cancer,
Okay.
kidney stones, and
Yeah.
I will mainly talk about kidney stones because
Yeah.
stones are very common in from young to old. The commonest cause of stones are dehydration, and as we live in Queensland in a sunny environment,
Ooh.
dehydration and being working outside. So, and I see a lot of people that drink Pepsi and Coke, which is the
Oh, well, at
highest
least they're
cause of
drinking
kidney stone.
something, but person like me doesn't drink anything. I
Yeah.
hardly drink water.
So, well, if you check yourself, you might have a kidney stone. But even if you don't drink enough water, you are slightly damaging your kidney. So, hydration is very important.
Only time I remember because I think I have read somewhere, and I think it's true. If you
That's
don't
why I
drink,
have
if
my
you
green tea,
yeah,
good for the
right.
kidney stone.
If you don't drink water for a long time, it will kill your thirst trigger. You won't feel thirsty. This is with me. But when I start drinking water, only then I realize how thirsty I was.
Yes.
And the other thing that happens to me, my ears start burning. That's dehydration, isn't it?
Yeah, if especially in winter, you don't feel too much thirsty.
No.
So you have to replace the fluid in the form of tea, coffee, and lemonade, some green tea.
Okay.
In summer, you will feel thirsty.
All right. Some Fiji people think that drinking kava will help, but I don't think so.
No, it's a drug.
Now, okay. So water is very important. Um, some people say you should drink as much water as you can. Is that right? That's not right, is it?
Not too much water. If you drink too much water, you dilute yourself. You know, your sodium level goes down. So
Yes.
just 2 to 3 liters a day with a mix of tea, coffee, lemonade. You know, you have to mix it.
Okay. Okay. Anything else you want to add on to that I may not have asked you
Look, I
because
see a lot of women with recurrent urinary tract infection. They come to
yes.
me with a lot of infection in the urine. So I look after them as well. I give them bladder wash, like they go to the dentist once a year. And sometimes it's very important that when they pass urine, they have to go to the toilet and wash themselves.
Yes.
And it's mainly hygiene and the secretion they have. They
Yes.
they can they get more prone to UTI, especially postmenopausal are at risk because they lose the estrogen. So
Okay.
washing is the critical step, but I look after them as well and to look
Okay.
after them. So the doctors can refer if they have recurrent urinary tract infection.
Okay. So it is just as important, very important, isn't it? And does diet anything to do with diet, with all this kidney and prostate and
Diet is, if
diet?
you see in our diet, generally speaking, not from urological point of view, we eat a lot of carbohydrates. If we eat refined carbs, it will
Okay.
damage us. You know,
Okay.
refined carbohydrates will give you a sudden insulin spike, which will make you drowsy, temporary pleasure, but it's not good. The
Can you
most
explain refinement? Some people might not know.
refined carb, like it's not a whole grain, you know,
Okay.
processed
Processed. Yeah.
flour or refined carbohydrate like chips,
Yeah. Yeah.
like cookies, biscuits,
Yep. 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 Yep.
sugar, they're all refined carbohydrates. If you want to improve your health and you want to make sure you have enough minerals, which is like zinc, calcium, magnesium, and
Yep.
selenium, you
Yes.
should be eating whole grain. Whole
Oh.
grain bread or whole grain or cereal or oats, they are loaded with a lot of minerals as well.
Okay.
So that, especially in the breakfast. But if you see our young kids, they are going for the all refined carbohydrates.
Yeah, I've got one at home. I know. He's addicted to it. Very hard to get him back to like green stuff, vegetable and dal and rice and things like
Yeah.
that. It is always. But anyway, so yeah, so
I'll tell, because from urology point of view, I also look after young men with sexual dysfunction.
okay.
They need help. You know, this now you don't have to be shy if you have men's health issue.
Yes.
If you have poor erection, I look after that as well. They are very good compared to 30 years ago when the mobile phone was used to be that long. We
Yeah,
have a
yeah.
small mobile phone. The technology has changed. Similarly, the medication for erectile dysfunction have significantly changed. We have new therapies, especially medication, different injection. If they don't work, then we have shockwave therapy that helps, that stimulate new blood vessel in the penis. If that doesn't work, then we have penile prosthesis. So all the young men, if they are watching and they have sexual dysfunction or low testosterone, I can look after them as well.
So popping all those pills without prescription could be dangerous for those people.
Absolutely, there's a lot of people are buying testosterone online. They're not going to help them. They're going to cause them prostate cancer, infertility, smaller testicle. So they should definitely see a urologist. There are many options for erectile dysfunction and low testosterone. They are two
Okay,
different things. Yeah.
all right. So, doctor, if somebody um, wants to get in touch with you, or what do? They go and see the doctor first, and then
Just put my idea. They'll tell that they can
just
check
say
my
that you want to
reviews.
see
They can
doctor.
speak to Dr. Ahmed Ali, the urologist. The GP will give them a referral letter,
Okay,
and then they can also check my detail on website Ali Urology, ALI with the urology, and you will find my details.
okay,
And I can help you for all the plumbing issues,
okay,
men's health issues, recurrent urinary tract infection, kidney
okay.
stones, enlarged prostate, difficulty passing urine, and recurrent UTI, especially in women.
Now, is there a detoxing kind of thing for kidney and all that? Like, if you want to, is there anything that you can detox your clean your
the,
kidneys or?
Look, there are many things if you go onto the Google, but try to avoid the one which gives you the toxin. We want to
Okay,
detoxin ourselves. Prevention is better than cure. If you look at the soft drink, they are fully loaded with acid and phosphate. They will damage your kidneys. So try to stay away all sugar because you put burden on your kidneys. So
so
detoxing
no
in
sugar,
terms
eh?
of lemon tea is pretty good
Yeah.
because it has a lot of citrus. It keeps the kidney nice and clean. It prevents kidney stones. But I would recommend that stay away from all the toxin like soft drinks and
Yeah.
refined carbs are the two dangerous. If
Okay.
you go to Woolworth, you see a lot of carbohydrates.
Yes, 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 yes. Apple cider.
Yeah, again, I have my patient. They come to me. I drink sometime apple cider, but I don't know what's the scientific reason.
You like?
Yeah,
Is it all right to drink apple cider?
yeah, but
Some people
it's
swear by
sometimes
it.
it's too acidic.
That's
Sometimes
what
it
I
can give you
feel.
a bit of reflux. The best is berries.
Okay.
Blueberries, strawberries,
Yes.
raspberry, plums,
Yeah.
pear, low
The
GI. That's
natural
the best, and
one.
they're
Yeah.
loaded with antioxidants. There's
Yeah.
definite research on that. Yeah,
Oh, okay. Because some of the things that you see on YouTube, there's so much there you don't know what is right, what is wrong. I suggest that you should go and consult your doctor, right?
absolutely. If
Don't follow all these things that you.
that artificial intelligence eventually will put them to death
Yeah.
because they come up with their own diagnosis. They are self-diagnosing. They are following different diets. Like some people are after keto diet. They are
Yeah. Yeah.
just
Yeah.
carnivores.
Yeah.
That's not right. You have to have a balance of everything.
Because that can drain you with other. Uh,
Problems
yeah. I mean,
because
that can
it's
drain you too, right? For
as
other
I
things.
said to you, people are trying to take like keto diet, which is
Yeah.
just fat and meat. But
Yeah.
where do you get your minerals from? Which
Like some
comes from
people
the
say,
whole grain. That's why we have legumes and cereal and oats because you have to have those minerals.
but some people say, oh, protein diet. I'm on a
Yeah,
protein
but
diet.
just protein because our body is full of a lot of reactions are happening at the same time. With
Okay.
those reaction, what we call those cofactors. If you don't have the cofactors, like zinc is a cofactor,
Yes.
you need to have zinc to complete the reaction. Okay, so if you
How
just
important is zinc? I've
zinc is
been listening a
important.
lot about it nowadays.
As I said, it's very important to complete a lot of reaction. It's a cofactor, but it's also been shown to improve your cognitive function. It
Yeah.
improves your
Okay.
muscle stability. Yes,
Oh, if you feel your muscle, your bone ache all the time, and if
yeah,
you're losing
magnesium.
your
Yeah,
muscle, then you take magnesium
yeah.
and zinc.
But which comes from, as I said in this video, comes from your whole grains. You don't want
Oh,
to go and buy star tablets now. Your legumes, your kidney beans, your chickpeas, kala channa,
yeah, yeah, yeah,
chickpeas.
yeah. Cheap. Yeah,
They are
yeah, yeah.
loaded with this.
Yes, right.
And
Yeah,
a lot
yeah.
of people don't eat. They just go for steak and a bit of dry mashed potato. No.
Okay, okay. So food. If you eat the right food, that's quite uh,
Yeah,
enough,
right
isn't
food,
it?
you are doing well.
Yeah. Okay. All right. Okay. Well, diet is very important out there. Remember, don't go and get a big piece of steak and all that. And you think you got everything. It has to
Yeah,
be balanced. Has to be balanced. Vegetables are very important too. Right?
yeah. Apps
Yeah.
vegetable, they have fibers, high
High
fibers.
fiber.
Yeah,
Yeah. Okay. Okay,
we
doctor. There
can
was
we
something.
can make another video next time, and just healthy diet and
Okay. Okay. We'll talk about that. How important is B12?
Look, all multivitamin B2, B6, B10, B12, all because you need it for neurological development. You
Okay.
need it for your nerves. All the B vitamins are
Nerve.
important,
Yeah.
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 And
Yeah.
again, they come from your all those things that I mentioned to you, whole
Okay.
grains and things.
Okay.
But people go to the chemist warehouse and they buy their medication and replace it from externally. No, you just naturally take it.
Yeah. Okay. You're a firm believer in natural. Take it
Yeah, I know
naturally.
medication. In Australia, we have good brands. You
Yep.
can buy them, but also in addition to that, you have to avoid the toxin. Like especially, it's only a few things, three things. If you take it away, you are happy.
Yeah.
The
Yeah.
refined carb is the biggest killer.
Yeah. Okay. Okay. Um. Sometimes people say your body is too acidic.
Yeah,
Have you heard of that?
yeah.
Too acidic. Uh, would that also cause your joint aches, body aches, if your body is too acidic? What would you think would happen?
I don't think so. From too much acidity, the main issue is when you are becoming too acidic, you produce a lot of lactic acid.
Yeah.
That can affect your kidneys.
Okay.
Yeah. So
Yeah.
when you have too much, like high protein, because a big load on the kidneys. So
Yeah.
you need to dilute that acidity by drinking lots of water.
Yeah.
Or
Yeah.
you
Okay.
can counteract with sodium bicarbonate, which is our baking soda that we put in the flour.
Or you have it and just drink it, you mean?
Yeah, you can take
With the
baking
water?
soda as well, or you
Yeah.
can buy baking soda tablets.
Oh. Well, I know my number one problem is
Looks like
water.
he's having.
I don't drink water.
he-
Honestly,
yeah.
I don't know when last I drank water. And I'm trying to tell myself every day to take water, take water. I don't know why. I just can't. Is it a sickness people can't take water? What is it?
As I said to you, in winter you don't feel thirsty.
Yeah.
So replace it with something else, which is warm water, tea, coffee, juice.
I like to say this again. That this research when I did, you don't think that you don't get in the thirst, you have got water in you, because it said there, if you don't drink water, and I know
Yeah,
I've been a guinea pig. I
yeah,
haven't been drinking,
yeah.
and honestly, I do not like when I was a child. I used to play and I used to get thirsty, go under the tap and drink water like non-stop. It doesn't happen anymore. I don't get the trigger of thirst because I haven't been drinking water, and I think I've killed the trigger.
That's and also you have to use your body to become thirsty sometime. You
Yeah,
have to go for a
well,
walk,
yeah, I
play a bit
use
of
that. I mean,
badminton.
I'm always doing that, but I'm active. But even at 71, I'm active.
You look
But
like 61, huh?
I, oh yeah, people tell me to slow down. I don't know what slow down means.
So the other thing you asked me about urology, what other things I can do? I see a lot of men
Yeah.
who are not circumcised. Circumcision is very important. The other thing
Oh,
I do,
okay.
they get a lot of circumcised. Circumcision is very important. The other thing
Oh,
I do,
okay.
they get a lot of chronic scarring of the foreskin.
Yeah.
A lot of men, they don't look after the foreskin. They go to the toilet, pass urine, they leave a bit of drops,
Yep.
irritation to the head of the penis, and then the foreskin start to stuck to the head, and that's called they call phimosis, foreskin narrowing and scarring. In long term, they can get penile cancer, and I have
Oh,
seen it in my clinic. So as soon as they start, if they can't retract the foreskin fully, only 50%, they should seek some advice, because they need to have
yeah.
it fixed.
There's some religious things in it too, isn't it? Like some
Yeah,
religion
really, so
don't,
we
don't. Some religion don't allow you to do it.
yeah.
Yeah, and some you have to do it. Yeah.
But if you
So,
have trouble, obviously
well,
you
if
have
you
to
have
do
trouble, then
something.
you don't. Yeah, of course. Yeah, yeah. Okay. Anything else I should have asked you, doctor, that I've forgotten? Maybe which will be good for our audience.
Look, I can talk about, if you really want me to come and talk about different topic, I can talk about psychology, how the human are doing, what the kids are going through, different topic. And
Yes.
also nutrition I can talk about.
Maybe we should do one on nutrition one day.
Yeah, nutrition and how we can change ourselves,
Yeah.
and our body will respond to what we do externally.
Yeah. Yeah. Okay. All right, doctor. Thank you very, very much for giving us your time, and I hope your listeners will benefit from this. And if you have any other question, you can
Contact me through my office
contact
and
doctor.
speak to the GP to get a referral,
Yep. Yep.
and it's all on the website as well.
Yep. Can you repeat your website again, please? Urology.
draliurology.com.au.
Ali Urology.
.com.au.
Yeah. .com.au.
It's not here, but
Yeah.
yeah, but that's
Okay. So that's what you do, and or all failing, you can send me or mine contact, and I can
refer
forward you all the
contact detail.
content. Or you can go to brisvani.com. You can go to brisvani.com, Brisvani, BRISVAANI.com. You will have all the information listed there. Okay.
Thank you very
Thank you,
much.
doctor. Thank you
Thank you,
very much.
sir.
I really appreciate your time. Thank you. See you guys. I hope this has been beneficial for you, and I will try to bring more of this kind of informative programs for you all, so that you all can benefit from it. Once again.